This video will be for ER department questions that maybe you face it in any interview in the future. So a lot of my friends, when they come to UAE, especially UAE, because I'm here now, they asked me, we have interview ER, can you give us some questions that maybe someone asked you before in an interview? Anyone can share his questions or share what he have from a questions that he faced in an interview. So assalamu alaikum, this is Marwan Shatiwi in his channel. Today I will make a conclusion, or I will make a brief about questions that you maybe someone will ask you in an interview, in a future interview. And this is my experience in UAE here. Maybe more than 4 to 5 interview here in UAE. So let's start. Now first I will tell you this is questions not with answers. So this is questions, just a question, and you will search about the answer. Actually the answer maybe you will find it in YouTube, maybe you will find it in any source you are studying in, and anything you want. Okay, so I will give you the questions, and I need from you some efforts to search about the answers of those questions. Let's start. First questions, in any department, introduce yourself, and you know how to introduce yourself. Just put this question on YouTube, search, and you will find the answer. The next question, the second one, triage. Triage is the first questions in ER department, and he will ask you what triage could you are using in your previous hospital. So we know there's ESI triage, emergency severity index. It's depending on resources and sorting the patient on the sources, on their resources. And there's colors, red, yellow, green, and the black. And there's also numeric triage. Just search about triage codes and just have an idea about a different type of triaging the patient in an emergency. Okay, the second question, and this is famous question in emergency chest pain, how to manage chest pain. So the first question, what is your management if you find a patient come to you in ED have chest pain? What you will do? Okay, this is management. What the symptoms of MI? Okay, so there is specific symptoms like chest pain right in the back and sweating like that. You will study it well, and according to SLA and according to SES, okay, according to American Heart Association, if you are just studying, because here all accredited by American Heart Association, okay, not European. So also symptoms, as you said, and door to door and door to balloon, and when you will give the patient thrombolytic medication, and when you will go to the cath lab, like that. Okay, and the management is very important. Let's pass to the next one because there are a lot of questions. Number 4, stroke like chest pain, also stroke, the symptoms of stroke, fast, facial drop like that, and the symptoms, and maybe he will tell you what's the meaning of fast acronym, and the management of stroke in your ED, what you will do and how to manage this case, and thrombolytic medication, and the golden hours below 3.5 hours. Okay, from the point of arrival to emergency. And after that, number 5, ACLS. He will ask you in ACLS management of bradycardia, whatever stable or not stable, and tachycardia, whatever stable or unstable. Tachycardia, what you will do. He will ask you when you will give cardioversion. So you will immediately will tell him. Will answer him when the tachycardia is unstable. When the patient is unstable, I will give cardioversion. If the patient tachycardic and stable, we will give medicine. And you will just discuss like narrow and wide, and what the type of narrow and wide, what we will give in narrow and what we will give in wide. You will study it all actually. If anyone pass the ACLS, advanced cardiac life support, he will just know what I mean. Okay. Management of tachycardia, and Cardioversion versus defibrillation. What's the difference between of them? Cardioversion and defibrillation. Let's pass to the next question, number 6. ACS and stroke algorithm and ACS review. No, I recommend the channel on YouTube. ICU Advantage. ICU Advantage. Just search on it. He is a good teacher, and he is actually explain everything. And I said it's very, very simple, and with algorithm, very fantastic. Actually, I recommend it perfectly. So ROSC, also return of spontaneous circulation. You will study it and what you will do in ROSC, like that. So after that, how to do primary survey, and secondary survey. This is for trauma. Okay, so when a trauma to come to you, what you will do, preparing before the trauma, prepare the environment, the equipment, the staffing, assignment of rules for staffing, like all that. You will make sure of suctioning working, and the oxygen is working, everything of that. It will be everything is okay. And number 9, intubation and how to assist and prepare, and chest tube needle decompression, how to assist and prepare, and for which cases, like that. And number 11, difference between tension pneumothorax and cardiac tamponade. Sometimes this question happen, asking and types of shock also. And PLS compression, maybe he'll ask you what you will do when you will find someone is falling down and without pulse, and you will say, don't forget safety first, check safety. After that, cardiac arrest, defibrillation, he will ask you maybe what defibrillation for what, VF and pulseless VTAC, like that. And use of drugs like adrenaline, atropine, adenosine, and amiodarone, and the concentration of drug, of the dose, how much, like that. After that, you'll ask about antidotes. Antidotes for medicine is very important, and 5 reversible causes, and I mean reversible causes, 5 H's and 5 T's is very important also. And after that, international patient safety goals, very important. 5 moments of hand washing. This is unify the questions in any department. 5 moments of hand washing, and donning PPE, doffing PPE, and how to deal with patient if he is upset or angry in ED. How to deal with this patient. This famous questions also in emergency department. And actually, this is the questions. All of these questions I faced it in emergency interview before, so whatever it's in Dubai or in Abu Dhabi. Actually, this is only headlines and only red line, big red line like this. And from your side, you should take all my those questions or these objectives and just study it well. Don't be stressed. Don't be stressed when you are in interview. The interviewer, especially in emergency department, he wants someone have self-confident in answering, and have to control yourself under stress. So if you are not controlling yourself in this situation or in this interview, how he will choose you as a nurse in emergency department? Because in emergency department you will face a lot of people with a lot of complaints, and how to deal with all of them. This is this horrible thing, and he need to see if you can be flexible and can be a wise man and cool under stress or not. So if you will not cool under stress inside the interview, how you can be a good man under stress when you are in emergency? So self-confidence is very, very important. Just study it well. And the do's of alteplase also, I forgot it. Do's of alteplase, and how to prepare alteplase thrombolytic medication, how to deal with it and how to prepare it is very, very important. And otherwise, you can also study fractures, burns, and you can study like how to deal with pediatric patients like that. But this is the most important questions I remember in previous interviews. And don't forget to be calm under stress. And good luck for all of you. Don't forget please to subscribe my channel and share this video for your friends, with you, your brother, your brother, nurse in emergency department in UAE, yes, in Abu Dhabi exactly now. And hope to you all success and to pass all your emergency interview, my heroes. And see you in another video. And assalamu alaikum wa rahmatullah wa barakatuh. Don't forget to subscribe and share and like. Thank you so much.